vaccines are an example of active immunity, and it's a medication that's amping up our immune response. And this is an artificial amp up of our immune response. So vaccines are considered an antigen, so it's going to be recognized as a foreign substance by our immune system, and it will cause the body to create antibodies. And those antibodies will also create a memory. So we'll get rid of and destroy the antigen that was introduced to the body, and then we'll have a memory of that previous infection so that if we're ever exposed to it, we won't get it. Right away, our body will amp up an immune response, get rid of it. We'll never have symptoms, or if we do, they're so low that we won't recognize them. So vaccines can come in multiple ways. They can be what's called inactivated or recombinant, meaning they've been genetically modified, so they're close enough to the original antigen or infection that your body will mount the immune response and create antibodies, but you won't get sick. Live attenuated are vaccines that do have live antigen in them. And so, although the response is attenuated so that you shouldn't become ill, it is possible that a person could become ill with that infection if they're immunocompromised. So that's the big difference in whether or not you can get the actual infection from the vaccine. And people that are immunocompromised should not be given live attenuated vaccines. But most vaccines are recombinant vaccines. So every year when you're made to take the influenza vaccine, or when you had to get the hepatitis vaccine, or you were recommended to get Gardasil, which is for HPV, that vaccine, those are recombinant vaccines, meaning you cannot get the actual infection from those vaccines. It's not possible. You're not being given the actual infection. You're being given a modified antigen close enough that it will create antibodies that would be able to fight the real infection, but not close enough to give you the infection. So you cannot get influenza from the influenza shot. You could get influenza from the flu mist because that's live attenuated, but not from the shot itself. So when I'm getting the immunization for the influenza virus, which is not to be confused with flu, which people use interchangeably to talk about all kinds of illnesses. But if I'm getting that vaccine, then I'm getting a modified antigen similar to influenza for that year that will cause my body to create antibodies for that specific influenza. And then if I'm exposed to it, my body will amp up its immune response and I won't have the symptoms. So what I'm left with after getting that vaccine is not the medication. I don't retain the actual vaccine. What I retain is the antibodies, the memory of the blueprint or the plan in order to get rid of that infection. So sometimes people say, well, I don't know if I want to get that vaccine because I don't know what's going to happen in the long term from getting that medication, but the long-term benefit of a vaccination is that you have antibodies to a specific infection because the medication is gone. The actual vaccine you got leaves. So why the confusion, or why do people are concerned about it? Well, because anytime your immune system is activated, increasing number of cells that are able to create antibodies or create the immune response, you will generate a fever and muscle aches and potential headache. So sometimes, for some people, it's stronger than others. When they get a vaccine, they'll get a headache, a low-grade fever, or some muscle and joint pain. That doesn't mean that they got influenza or hepatitis or any of those infections. That means their immune system is responding to the vaccine. You can also expect some pain at the injection site because that is obviously a shot. So for the exam, you have to remember what is the safe way to give IM injections, especially in the deltoid. It's 2 to 3 finger breaths below the acromion into the deltoid muscle itself, not into that tendon, or you can cause disability. And the correct way to give vaccines is to have the patient sit or lay down in the office for 15 to 30 minutes, because all vaccines have the potential to cause transient hypotension. So that can be kind of funny because if you've ever gotten the flu shot at work, the influenza shot at work, they give it to you and you go back to work. There's no resting or waiting. But that is actually the correct way to give it, is you should be allowed to rest and wait. If the possible contraindications are especially present, you could be allergic to any of the vaccines, especially however they were created. So certainly an allergy to the vaccine would be a contraindication. If you're supposed to get a live attenuated vaccine, there are reasons not to get that. One is maybe you're immunocompromised, because then you could get the infection. Your body won't be able to create the response it's supposed to. Two, you could live with someone who's immunocompromised, and that close contact, you could actually expose them to the virus or whatever infection it is, and they could get the infection. A pregnant person should not get a live vaccine because the unborn fetus could get that infection. That could end up causing miscarriage or other complications. So that's really the reasons not to get vaccines. The principle behind immunoglobulin therapy is that the patient, maybe they're not able to make the antibodies, or we don't have time for them to make the antibodies. And it's usually because they've been exposed to an infection before they could get the benefit of a vaccine. So if we don't have time to make the antibodies, or the patient is not capable of making antibodies, we can give them immunoglobulin to hopefully prevent them from getting the actual infection. And your prototype medication of immunoglobulin, an example of passive immunity, is HBIG, which is hepatitis B immunoglobulin therapy. So if you are exposed to hepatitis B, which is very dangerous as there is no cure for hepatitis B, and no medication that can be given, that is why healthcare workers or people at high risk should be vaccinated against hepatitis B, because it can live in a dried blood sample for 7 days. And most people now in infancy get that vaccine. But say you didn't retain immunity, because there are some people that really have a hard time doing that, and they'll get their hepatitis B immunoglobulin checked and they no longer retain that immunity. Or you didn't get the vaccine for some reason and had an exposure to hepatitis B, you could be given hepatitis B immunoglobulin therapy. But in order for it to work, you have to be given it right away. So within 24 hours of exposure, but no later than the week of exposure. So say I was exposed to hepatitis B on Monday, it would be ideal for me to get it in the 24 hours around the time that I was exposed, but I would still get benefit from the immunoglobulin therapy for the next week until the next Monday. And then I do have to repeat it again in a month for the time I got it in order to be sure that's effective. So I'm giving people antibodies, which is an immune response. And so the person can again have similar side effects that they did when they got the vaccine, which is flu-like symptoms, maybe a low-grade fever, headache, joint muscle aches. It's given intravenously, so there could be a reaction on the skin, and you could have transient hypotension when the medication is being given. All the same stuff that we worry about with vaccines. There are some extra adverse effects that are listed on that slide, and that is severe allergy leading to anaphylaxis, clots, which is what thrombosis means, or renal toxicity. So anytime those come up, we should always remind ourselves what sort of symptoms that would be. So anaphylaxis is the most severe type of allergy, which means there's facial swelling and difficulty breathing. Thrombosis is a clot. So you know a person has a clot because either they have a stroke, so they have stroke symptoms, weakness on one side, trouble speaking. Renal toxicity means their kidneys aren't working, so their BUN and creatinine will be elevated. They'll be retaining fluid, which means their weight could go up, their blood pressure could go up, there's less urine output. So always remind yourself on what those symptoms mean, or what that means to have that The last of our immunostimulants is interferon. So interferon is another part of the immune response. It works by sort of calling up and warning other cells. It helps to assist the immune response. So if we give somebody interferon, we're helping their immune system work better to fight an infection. And people can still use interferon type treatments for some viral infections and for some cancers as well. So interferon that we're going to talk about is an interferon treatment for hepatitis. So people can be given interferon therapy for hepatitis B infection because there isn't a lot of good treatments for that. There are much better treatments, antiviral treatments for hepatitis C that can actually clear the infection. But you can give somebody what's called interferon alpha 2A treatment for hepatitis. This can be a subcutaneous injection and can be given at the clinic or at home. So side effects, again, we have the flu-like symptoms. So that's low-grade fever, headache, muscle joint pain. There can be some GI side effects, which is different from the other ones. Nausea, vomiting, diarrhea, could cause hair loss. The issues, the adverse effects that we have to watch out for are profound headache and seizures, bone marrow suppression, so that's red blood cells are down, white blood cell down, and platelets are down, so obviously that didn't work very well at all, and an increased risk of suicide or severe depression. So we want to be sure that the patient is aware of those things as well as their family in case they notice some behavior that is concerning. And then lastly, with the immune medications, those were the immunostimulants. So we talked about vaccines, in particular recombinant and live attenuated vaccines. So that'd be MMR is the live attenuated, influenza or hepatitis B is recombinant. We talked about immunoglobulin as a way to amp up the body's response after an exposure if the body doesn't have time to make antibodies. And we talked about hepatitis B immunoglobulin therapy. And then we talked about interferon as a chemical messenger that can help amp up the body's immune response, and that is one of the treatments that can be used for hepatitis. You can give medication because you want to suppress the immune system. So we've talked about that before in terms of rheumatoid arthritis, which was a chronic and autoimmune disease, which can amp up the immune response. And we talked about medications like prednisone and methotrexate. And this medication then comes up again. You can use prednisone and methotrexate as immunosuppressant therapy when you're concerned about organ rejection, which is what we're talking about now. So people's immune response can be amped up after getting an organ transplant because that isn't, the body recognizes those cells as cells that don't belong to itself. And so the body will start to mount an immune response, which could lead to rejection of that organ. So the way to combat that is to try to suppress the body's immune response. And so just like we've done with blood pressure medications and with antibiotics, certain things you have to worry about with all immunosuppressant medications, and that is that you have to worry about infection. Because we are suppressing the immune system specifically to stop organ rejection, but that doesn't mean that the person might not be exposed to infections, and if they are, then they can get really sick because they won't be able to control that. So these measures, infection control measures, are also part of things that we should be concerned about for chemotherapy as well, because those people are also at risk for infections. So good hand washing, avoiding large crowds, especially indoor crowds because they're the air, you're sharing the air more. Avoiding people with active infections, avoiding very young people usually under the age of 12 because they are more likely to carry infections. Cooking food very thoroughly to avoid food poisoning, avoiding raw fruits and vegetables for that same thing to avoid food poisoning. And then, of course, these people would not be getting live attenuated vaccines. So the new drug that we're learning about, because we've already learned about prednisone, and we've already learned about methotrexate, which we'll talk about a little bit more. But cyclosporine is a new medication that we'll talk about, which is an immunosuppressant. This is an anti-rejection medication specifically, and it works by stopping T helper cells, which are one of the steps to creating antibodies. So you'll see there's two things listed there that are extremely common side effects for people that are taking this medication. 75% of people will have a decrease in their urine output, and 50% will have high blood pressure or a tremor. So people with decreased urine output, that would be meaning that we would have to be sure we're watching their fluid intake and fluid output. And sometimes that means that maybe if the patient needs to be on this and this is a problem, they might end up on a diuretic. Other side effects include headache and gingival hyperplasia. So other adverse effects, elevated liver enzymes. We know we're going to bring the white blood cell count down because it's immunosuppressant, which does put them at increased risk of infection. And they do have a long-term risk of other types of cancer. This is another example of a medication where we should avoid grapefruit juice too. Methotrexate, we talked about rheumatoid arthritis, but when we talked about it then, we talked about it as a lower dose that we were taking once a week. If we're using methotrexate as a treatment to decrease rejection, they're going to take it every day. And it blocks the synthesis of folic acid, which is needed by fast replicating cells, and your immune cells are fast replicating cells. So this was the pregnancy category X. You're supposed to handle it with gloves. You're not supposed to inhale it. You can't take it with NSAIDs because of that fatal myelosuppression and potential kidney disease. It can cause hepatotoxicity, mouth sores, diarrhea, and those fatal skin infections. The other thing that's not listed on there, which we talked about with rheumatoid arthritis, is pulmonary fibrosis. So methotrexate is a dangerous medication. It can affect, it's obviously going to decrease your white blood cells on purpose, so it does make you more prone to infection. You have to worry about liver function for sure, and mouth sores and diarrhea. You have the potential for those serious skin reactions. You have the potential for pulmonary fibrosis, and if you take it with NSAIDs, you cause the severe bone marrow suppression, so you have to avoid that.